Now we're all acutely aware of the fact that N95 respirators are very hard to come by right now if you didn't already have a stock of them, at your facility. So what the FDA has done under their emergency use authorization is temporarily allowing some of the respirators that have not been tested and authorized by NIOSH to be sold and purchased in the United States. This is only for the duration of the public health emergency related to COVID-19 that's been declared by the Department of Health and Human Services. So once regular N95s that have been authorized by NIOSH become available, or there is no longer a health emergency, then these can no longer be used. So I guess the point there is, don't go out and buy 10,000 of them if you only use 1 or 2 a day. The specifically authorized respirators are on a list that the FDA has created, this Appendix A, authorized respirators, which can be downloaded from the FDA website. And I would say that if you're considering buying something like, say, a KN95 respirator, which are kind of notorious for having counterfeit knockoffs, that you want to refer to this list and make sure that the ones that you're buying are from the vendors or the manufacturers who have been authorized by the FDA under this EUA, this emergency use authorization. Respirator use in the workplace is also regulated by OSHA. Now, OSHA always makes this statement, employers must first institute engineering and work practice controls before resorting to PPE as a measure to protect workers. The truth of the matter is, in dentistry, we have to use PPE as a primary method of protecting workers because we don't have engineering and work practice controls that would eliminate the hazard of coming into contact with body fluids. So PPE is how we do that in dentistry. But if we're going to go to the level of an N95 or any other type of respirator, you have to first establish a written respiratory protection program, and there has to be an administrator assigned for that program. And before an employee can use an N95 respirator, in addition to the fit test I mentioned, they also have to complete a medical questionnaire, a specific one that OSHA has developed. That has to be reviewed by a qualified medical professional who then determines whether or not a medical exam is necessary. And then you also have to have training, including training on COVID-19. There's a lot of resources for training, and I'll talk about that in just a minute. OSHA has also modified some of their requirements in the standard during this time of shortages because they understand that not all of these things are going to be possible. So you want to take a look at their website before you implement a new program and kind of check back there regularly. And I'll show you what that looks like in just a minute. Some of the temporary enforcement guidelines that they've put out are that all employees are required to use or are permitted voluntary use of a respiratory protection must continue to manage their program in accordance with the OSHA standard. So you do still have to have a written program and all the things that I just talked about. They also have to address in your respiratory protection program the circumstances under which a disposable respirator will be considered contaminated and not available for extended use or reuse. And we haven't talked about that yet, the extended use or reuse of a single-use respirator like an N95. And I'm going to discuss that because that's also come out of this shortage and there's specific guidelines for that. Additionally, OSHA has directed its field offices to use their own discretion as to whether or not to cite an employer for not providing annual fit testing. And so at this time right now, if you are in a setting where you or other employees have had an initial fit test and you're due for your annual test, you can delay that until after this crisis is over. But the initial fit test still does need to be done. Some of the resources that I have found to be very helpful in developing respiratory protection programs for dental settings are, first of all, OSHA has a toolkit. It's called the Hospital Respiratory Protection Program Toolkit. And even though it says hospital, it's actually quite useful for any other type of healthcare setting. I'd say the only thing about it is in the template, they have a template for your written program where you can just fill in the blanks, but you can remove all of the parts of that that don't apply to you. So if you're not using elastomeric respirators, if you're not using air purifying respirators, you can just delete that from the program and only address the N95s or the filtering face piece respirators. It also explains what the standard requires, and it also has that health questionnaire that's required to be reviewed by a healthcare professional. The National Institute for Occupational Safety and Health also, because they are the ones who test and approve respirators, they have a lot of resources on their website, including some interim guidance for during this period on considerations for the use of respirators. They have training videos, they have infographics, a lot of things that can really help everybody understand the proper use of a respirator if you're going to use those. And then finally, I just added this, the American Association of Occupational Health Nurses, AAOHN.org, has on its website a number of educational materials, but one that you might find particularly useful is they have a respiratory protection program for healthcare workers. That's a 2-module training program that was developed with funding from NIOSH, and it's free of charge. All you have to do is set up a guest account with the organization, which doesn't cost anything, and then you go back in and you access these training modules, and when you complete them, you receive a certificate that you've completed the training. There may still need to be some site-specific things that people need to be trained on, like how to dispose of the respirators and how to access them and things like that. But this really provides the bulk of the required training. There's also some training videos on the OSHA.gov website.